And still on the situation in Sudan, the aftermath of heavy fighting is telling heavily on Sudan's health. Hospitals are now reportedly filled with people with health challenges and injuries from this crossfire. The pressure on hospital facilities has led to the offer of medical services in poor conditions. We have a report.
Sudan's health sector is facing a looming collapse as infrastructure and hospitals in many cities were damaged or even completely destroyed by heavy off-and-on fighting between the Sudanese armed forces and the paramilitary rapid support forces. The escalating violence in the country in recent weeks has had a catastrophic impact on civilians despite the ceasefire agreements, with hundreds losing their lives and over 1.3 million people estimated to be displaced. Millions more now find themselves unable to access vital services or healthcare facilities. For more than a month, patients from Sudan's capital, Khartoum, have been forced to seek healthcare and medicine in other places. Some suffer from respiratory diseases.
I walked from Khartoum to Abu Shah to find a hospital and medicine. I suffer respiratory diseases. People have welcomed me, and I was transferred to Al Hashisa Hospital. Doctors are helping me for free, and they bought extra beds so patients can stay here.
The conditions of several hospitals has become very poor due to pressure.
We are facing huge pressure in the wake of the fighting in Khartoum. We are doing our best to meet the needs of the patients, but the hospital lacks emergency medicine and equipment, especially oxygen, tubes, nutrients, and also medical solutions.
Aside from the high load in the hospital and the lack of equipment, another challenge is the power outages. We have 3 generators, but the hospital needs bigger ones, especially in kidney dialysis and surgery sections. The resources are limited amid challenging conditions.
Since the fighting broke out in April, over 70% of hospitals in the country stopped operating as they were located too near to the areas of the clashes. The World Health Organization also confirmed that several health facilities became targets in the fighting. Although medicine and medical equipment were donated to Sudanese hospitals by the United Nations and other organizations, the difficulty of delivering aid and securing safe humanitarian corridors amid fragile ceasefire agreements was still a major challenge.